Um, but in the meantime, the first piece of information I thought was really important to conceptualize the rest of, okay, how do I do this, is to keep in mind what are the steps of adjusting to change. And while for most of us, we're thinking about the change to this new virtual world reality, in some respects, these stages of change actually also mimic what someone goes through when they're diagnosed with cancer. So as you think about creating that virtual connection with people, you have to sort of wear two different hats. One would be, where am I in this process of adapting to change? Where is my client or my patient in the process of adapting to change? And for the patient, and how are they also adapting to whatever's going on for them related to cancer? So in phase one, this is when we're really struggling with the challenge to the status quo. And the emotional response here is often one of denial or shock. So, you know, in this phase, you know, individuals are often going through, you know, perhaps a withdrawal from the present day reality and really focusing on the past, really struggling to accept that things do need to change. There might be activity at this time, but not much progress in that, you know, if you're in some form of, you know, surprise because you're shocked, or if you're in denial, it's really hard to have a sense of truly making progress on a problem. And so some of the needs when people are in this very first phase is, you know, information that can help them ease the shock of the transition and facilitate their understanding. I think people really need time to adjust and process what's actually happened. And clarification, you know, if you're struggling with the change, you know, how can you get help? Now, at this point, you might not be able to take action on it, but it's a really great opportunity to plant some of those seeds, both like what are the resources for you as a provider in your organization, as well as your patients. And, you know, again, this phase, some of it's personality, temperament. You know, some of us are more adaptable. Other people take a longer time to come along. Your patient might be fine, but their family members might be struggling. So, you know, it's a bit of a conundrum, but hopefully people make it out of the denial and shock phase, but then they go into having to deal with more of that reality check of how this has disrupted their life. And here is where you often will notice resistance to the change, and strong emotions, whether it be anger or fear, anxiety, desire to blame, and or depression, right? And all of those feelings are quite strong. They're very normal, but trying to figure out, okay, how do I handle this when it's coming into the room and perhaps taking us away from the important work we're trying to do together. You know, the needs here really are doing what you can to plan and prepare for how to respond to the strong emotional response, mitigating those problems as best as you can. And what's really crucial in this moment is to actually, rather than maybe go for those desire to reassure yourself or the other person that everything's going to be okay, start with just expressing those feelings and finding a way to respond through validating and being compassionate. Because while we all want to remind people that they're stronger and more resilient than maybe they often give themselves credit for, when you're engaging with some level of resistance, that needs to be heard first, because if those feelings are heard, they can subside and then you can move forward. And so, you know, perhaps you noticed this early on in this whole COVID-19 piece, where I know several of the clinicians I work nearby were like, I love my job, but I hate the virtual format. And that was tough because it's hard to do the work that you love if you're personally sitting in that level of resistance. But through expressing it and not trying to pretend it doesn't exist, we actually can be more effective in moving on to phase 3, which is on the next slide. So in phase 3, this is generally a more welcome phase because it's all about exploration. And the emotional reaction or response at this time is one of acceptance, whether it's accepting that, okay, this virtual world is going to be a part of my professional domain, for our clients, accepting that that might be the way that they're going to engage with their providers, and or even accepting the fact that they have cancer or whatever age and stage that is. So, you might anticipate that this is going to be a little bit more of a fresh breath of air because there is more openness to learning and developing new skills, to going to trainings like this one, chatting with your colleagues about how they're managing their work. And there's an opportunity to perhaps get excited about how this change brings in new opportunities. When I think about, in particular, my work with the Bessie Wright Center, a number of the people who ended up joining the group were driving 2 to 3 hours sometimes just to simply get to their medical appointments. And so getting that emotional support that they really deserved and needed was often, they didn't have the time, energy, financial reserves to do that. And so they really appreciated this opportunity. And as we all adjusted, they saw how effective it could be. So while it's a breath of fresh air to be in the exploration stage, it's still important to perhaps manage your expectations, because while you've accepted the change, you're not necessarily going to feel really skilled. There's still going to be challenges as you're actively learning how to roll with this new development. And so having those bumps in the road might even put you back into another phase where you reminisce about the past and you miss how your work life was easier prior to this, or perhaps bring up strong feelings of resistance like in phase 2. So if you're managing your expectations, you're going to be much more able to roll with whatever's coming up. And then we want to support the openness to change by refreshing memories of the resources available in your organization and in the organizations you collaborate with. So, for example, you might have planted the seed that for your patient, they should check out a support group. But if they were early on in their adjusting to this new change, they might not have really heard you. And so when someone's in phase 3 of exploration, it's a great time to remind them maybe of the things that you mentioned early on, but now they're actually in a place where they could consider taking it, really taking it on. And then phase 4 is the rebuilding phase, and in this phase, the emotional reaction is some level of commitment to change, commitment to this new way of being, and in this phase, these changes, the changes that have occurred start to feel like second nature. Your level of confidence in being proficient, being comfortable increases. And at this point, collaboration and focus improves because you're no longer trying to rewire your brain. You're no longer confronting as much resistance or as much confusion or as much desire to return to the way things were. And so that gives you this ability to really begin to see you know, oh, what are some of the long and short-term goals? What are these new opportunities that are coming into us? Because now we have more tools, more ways of connecting with people, and goals that were possibly set aside because of the crisis that we've been going through. One really important need, though, I think in phase 4 that sometimes gets overlooked is celebrating the adjustment that everybody's gone through. You know, sometimes it can feel a little hokey to do that, but you know, when we acknowledge and reaffirm the growth that took us to go from phase 1 to phase 4, that first of all reaffirms the connection that you have with your clients, with your colleagues, and with the people around you. But it also gives you that opportunity to see that despite the hardship, you're more resilient than maybe you gave yourself credit for. And this is something that I do a lot with clients, where whether I might disclose, oh, how I've adjusted or what I've seen them doing. And that, again, just helps them feel more confident, because as we know, cancer will continue to throw curveballs, and apparently COVID-19 will continue to throw curveballs as well. So those are like the general phases of adjusting to change. And so as we go through the next slides, I want you to keep that in mind of like, okay, how I might apply these tips and tools and suggestions are going to look different depending on what phase I'm in and the person I'm working with. So ready to move on. So this slide focuses on coaching your patients and clients. So as I just mentioned, before you even get to the active coaching phase, it's really important to assess where everybody is, especially emotionally related to their illness and to the change in virtual appointments. And it could also include their caregivers, depending on whether or not they're an active part of the meeting. You might find yourself having to navigate 3 different states: your own, your clients, and the caregivers. So if you are feeling any performance anxiety, it's so important, you know, that you're probably not the only one. And I'm a really huge proponent of name it to tame it, you know, because this not only normalizes that performance anxiety is very common, but it also gives your patients and clients permission to disclose the same if they need to. I think it's also really important, like we're 4 or 5 months in, but check in with any assumptions that you're making regarding the comfort and skill level with telehealth by asking, you know, checking in with your clients. Because if you are checking in with them, again, that just gives them permission to perhaps not feel ashamed of not knowing what they're doing, especially when you take into consideration some of the more profound side effects that come with cancer treatment, and its emotional aftermath, that what might have felt fine in one session, something might have come up, and they're again sort of needing some hand holding there. I also think it's really important to, I call it mindful manners. You know, I've been on appointments with my son, and you know, they're taking notes, and it's really funny because like all of a sudden the eye contact goes from here to the computer. So if you're writing and typing notes, of course, that's something that you've probably been doing when you were sitting face to face, only the person could observe you doing it, so it needed less explanation. So of course, not only mention, but you might even invite your clients to do the same, even if we work to our best ability to decrease sort of that power dynamic. You know, because you are the expert, because you are the provider, a lot of times people will unconsciously defer to who you are and how you, what you invite them to do or not do. as well as sort of explaining any break in eye contact. And I definitely don't recommend that you stare people down the entire time on a call, because you wouldn't do that anyways. But think of how many times you've made up, if someone's not explaining to you what they're doing, the movie that you have going in your own mind, your own explanations, sometimes, or 99.9% of the time, your own assumptions are really off about what someone's doing. And of course, people going through cancer treatment are often concerned that they're going to hear bad news. And so the more you can explain the nonverbal language that that you're displaying, the more at ease your clients will be. And I really do think that, you know, as you're coaching your patients and clients, by validating these changes, by commiserating around them, that builds connection and rapport that maybe you would have done in different ways when it's face-to-face. But it also gives us the opportunity, again, if we can acknowledge the challenges, we can also make space for those silver linings. You know, how has this amplified your connection? You know, I found it to be really like having people be in their home, and they're in their in a place where hopefully they feel safe and comfortable. You get to see a little bit of their personality, and likewise they may be seeing a little bit more of your personality. So that kind of, you know, in this world in which sometimes virtual meetings can feel very disconnecting, there's a way in which they can also be very connecting. And again, sort of reducing those barriers to being able to see you. And it's very nice when you don't have to leave the house. So by giving both the challenges some air and the silver linings to come out, you begin to sort of be able to clear away the clutter of those emotional barriers, and then move into whatever it is you're trying to accomplish with them in any given moment. The next slide is all about facilitating connection, right? So I was talking to my family about how I was going to be doing this presentation, and my cousin was like, I just have no idea where to look. How can I actually have effective eye contact? And it is a challenge, you know, and I don't think that people expect perfection, but one of the ways you can do that, now today I'm on my cell phone, so I'm looking at my slides, but I can, you know, look up and see my little camera there. So it's pretty close. But sometimes when you're on a laptop or a computer, the window that you need to see, whether it's the notes that you need to write or your client's face, might be actually quite far away from that little camera hole. So if possible, if you can move that little box closer to where the camera is, you'll have a better opportunity to be able to observe their nonverbal body language and what they're saying to you, while also trying to give direct eye contact. But, you know, if you're not able to move around the box, or if what you need to do is makes it difficult to look at them in the eyes, you know, I think when you come in, making that initial greeting a very eye-to-eye moment, and then showing in other ways that you're attending to what they're saying and the concerns they're bringing into the room. So for example, even though you might not be greeting clients face to face, you know, having that warm greeting when they come online, you know, just helps to normalize that, yes, we are still, it's still you and me. We're doing it in this weird format. And that's a great time to make sure you're doing as much direct eye contact as you can. Our reflective listening skills, which encompass both what the person has said and then perhaps their nonverbal cues as appropriate, is going to help that person realize that while you're not face to face, they don't necessarily have that the energy of being right in the same room with you, they begin to really sense that you are truly there and truly listening and truly helping them. And so those reflective listening skills can really facilitate them feeling that connection with you and you feeling that connection with them. Because I know for me, again, I chose to do this, but it was still a process of figuring out how to make it as effective as in person. And then, you know, obviously try to be mindful of your nonverbal responses. You know, if you're leaning in, they can feel that versus if you're leaning backwards. I mean, sometimes if you've been on it all day, again, you might just explain like, oh, my body's been sitting a lot today, I need to do a stretch. That might give them permission to stretch, or even a reminder to check in with their body. And then finally, closing a meeting, both with whatever the plan is the next time you're going to connect, or the resources or referrals that you're going to make for them. And go ahead and do that gesture, do the wave. Waving at the camera is very similar to that handshake or hug. So rather than just cutting off the call, follow that normal protocol. Whatever you would have done will help people feel like it's less detached and more approachable. The next slide that I think is super, super important is, you know, it's one thing to have all of these ways of connecting with someone and to be thinking about the people you serve, but when you've had to adjust to change and you're doing your job in a way that maybe you never expected you'd be doing it, it's very useful for your own personal motivation to really think about your deep why as well as your unique gifts. So taking time to really remind yourself of what your particular mission or purpose is. Why did you get into this work? What was it about the face-to-face with your colleagues, your coworkers, your clients that really kept you going day in and day out as you faced adversity? You know, that really reminding yourself of why you're doing the work can help counteract the reservations you may be feeling about providing virtual services. And then, you know, reminding yourself again of how these virtual services do reduce barriers and maintain a sense of connection for your patients and clients and their caregivers. Because as we know, cancer can be a very isolating health condition to have. And so even if people have to, you know, really take time away from face-to-face interactions, you know, the fact that you're calling in, the fact that you're demonstrating concern, the fact that you're demonstrating you're still present, even if you're not in the same room, helps them to feel less alone. And again, for me, that was absolutely part of my deep why I got into the work that I did. And I would imagine that that's a piece of what's felt really gratifying. I know with my team, my treatment team, was some of the most amazing relationships I've ever had with medical providers, because we were going through such a huge life-altering experience, and you know, I felt their presence every step of the way, and that made a huge difference. And while I can imagine trying to navigate cancer treatment and COVID, I know that for the people who I continue to work with, they still feel that level of presence, and it's super important to them. But that being said, you're trying to adapt to this new way of being. And so when you're trying to figure out, how do I personally feel more confident in the work that I'm doing, in my skill level, in the virtual collaboration, think back to, you know, what are your strengths as a provider? What do you bring to the table? So not necessarily in this virtual moment where you're like, oh my gosh, I'm trying to figure out everything, but you know, in the days before, what were your strengths? what did people say to you, you know, about your style? What did they appreciate about the relationship they had with you? Because if you can get really specific about those pieces, it can definitely help you begin to interpret how to bring that presence back online, you know, so that in some respects, they begin to notice very little difference between the face-to-face and the in-person. So, you know, for me, I think some of the strengths that I've had are, you know, I'm a very friendly person, so I made sure to really bring that to the table. Clients will often talk about how calming I am, even when they're having a very difficult moment. And so not only sitting in my calm as I approached these calls and as I approached group work, but also thinking about, if I'm not feeling calm today, are there things that I can bring into the room that would not only benefit my client, but would benefit me as well? And then the other piece that I've been skilled at, and one of the things I actually loved about virtual work, is that creating, you know, when you come to groups, being able to listen to what the person who's speaking is saying, and, you know, in the gallery view, actually being able to monitor people's facial cues. You know, people have always appreciated how I've helped them see connections. And so the virtual toolbox has actually been a gift when it comes to group facilitation. Whereas, you know, when you're in a room, sometimes you don't get to see everybody's face at the same time. So while I definitely had to adapt, it's been really pretty incredible. The following slide is to emphasize that while we want to create connection, and that's our ultimate goal, I also want to validate the fact that Zoom fatigue is real. It's not just a figment of your imagination. It's not just your desire to not have to do so many things virtually. And so here are some key points to keep in mind. When you think about traditional communication, you know, 55% of communication is body language. So when we're sitting virtually in a room together, we're not seeing the majority of a person's body. 38% is the tone of voice. And while, of course, we will hopefully be able to hear one another, when you think about the tech drop calls, the tech lags, those moments where you're like, oh, you froze, you know, that's going to sometimes perhaps shift what the tone of voice is trying to communicate. It might not actually be about whatever the subject is. It might be some of the frustration of the glitches that come up. And then 7% is the actual words spoken. So as you can imagine, your brain is working so much harder to reconfigure to this new norm. It's not able to use the nonverbal communication cues the way it's accustomed to. And so that means that our minds are having both less information to analyze and respond to, while on top of it, trying to keep us in the game and keep us thinking about the work we're trying to do and our whatever our purpose is. And so naturally that's going to make your brain feel a lot more tired. And you know, I mean, of course you think about the eye fatigue and now the need for wearing those special glasses that have the blue lens or whatever that is. And so it's like the brain has less information, yet at the same time, the mind always wants to compensate. So people are finding themselves that they actually might be emoting more, whether it's consciously or not, in order to try to, you know, communicate those messages. And so if you're emoting more in an attempt to be seen and heard appropriately, that's in and of itself is going to be exhausting. In a group call, what can be challenging about that is amplifying that need to try to multitask. You know, how do I stay attuned to what the person's saying while thinking about my own body language, while perhaps tuning into the rest of the people in the room. And while I ultimately found that to be a bonus in the virtual group work, the one thing that you're not getting anymore is your peripheral sensory information. It's not able to help you because probably in your periphery, you're seeing your room, so you might get distracted by, you know, the knock at the door because your kid wants to come in and ask, you know, if they can play games, or your animals walking around. Whereas like when you're in a face-to-face meeting with someone, your peripheral senses are actually collecting information that is hopefully pertinent to the situation. So you have to kind of shut down some of your peripheral senses. And that again is a huge adjustment. And, you know, finally, you're sort of adapting to the fact that, you know, one of the things that helps build connection and rapport is that energetic exchange between human beings. While we don't always have pleasant interactions with one another, we do, again, that energy helps us understand a person's situation, and it gives you this opportunity to respond more intuitively. And so we're having to reconfigure the energy that we get and receive from people. And so this initially maybe impacts your ability to resiliently respond to adversity when it happens. And of course it can increase the likelihood for miscommunication because, again, you know, 93% of what we would be communicating to people has been changed. It's not the same. So part of this particular slide, the information came from a National Geographic article, and I just really love this quote because I think it really helps to explain the Zoom fatigue situation. So for some people, the prolonged split in attention creates a perplexing sense of being drained while having accomplished nothing. The brain becomes overwhelmed by unfamiliar excess stimuli while being hyper-focused on searching for nonverbal cues that it can't find. Now, hopefully, even if you're feeling drained, you ultimately are accomplishing something. But again, our way of analyzing what we are and are not accomplishing in these calls is changing. We're adapting, right? We're in a Darwinian moment. And so it can give that sense of like, what just happened? Did the work that we just did like actually move something along? And so if you're finding that moment of worrying that perhaps you're not accomplishing what you're setting out to, that's maybe a sign to go back and think about, okay, well, let me think about what phase of change I'm in and what phase of change everybody else was in, because maybe that will help me understand and figure out exactly what went well and what didn't go well, and then go back to the next meeting with more of a plan in place, as well as an opportunity to say, okay, I meant to say this, I'm not sure if that's how it came across. And, you know, just a final plug for, you know, remembering your why is another way. So analyzing what stage in, remembering your why helps you kind of combat the fatigue, or perhaps make more space for this adjustment as you come through. Because, you know, I think about, well, I've done the Try for a Cure before, and it was an incredible accomplishment. But if I had just been stuck in my moment, like fear of swimming in the ocean, for example, I might not have ever gotten in the water. But remembering my deep why, it was 1 year post-treatment, and that was something that I really wanted to do, helped me overcome my anxiety about swimming in the ocean. And it definitely helped me keep going by the end of the race when I was so tired. So, yeah. So we've talked a lot about facilitating connection, coaching clients, thinking about the phases, thinking about your deep why. But there's also some nuts and bolts that probably by now you've kind of gotten into your own rhythm. But I wanted to go through this pre-call checklist because I thought it was very useful in sort of either explaining why I've been doing things the way I've been doing, or also helping me prepare better. And so obviously, you know, you want to make sure you're on a secure, password protected Wi-Fi or Ethernet cable if possible. Wi-Fi is great, but if you've got the juice going right into your computer, often you're going to mitigate some of those challenges you may be experiencing. It's so important to exit all the programs and tabs that you have open. If you can, pause the backups that your computer might be doing, or even maybe talk to someone in your organization who has a handle on when the backups are scheduled for, possibly changing that protocol as people are really needing their computers not to drop calls. And do whatever you can to preserve the internet bandwidth. You know, I love having kids because they understand technology better than I do. And so they would always laugh at me because I would, you know, go into a program and come out and I click thinking that I'm really done, but I haven't swiped up. So, you know, this is a reminder, swipe up, double check that you haven't left something open accidentally. For privacy concerns, obviously everybody here does our best not to have interruptions, but more importantly, be mindful of what your camera is showing about your home or workspace. You know, there might be, you know, pictures of your family that perhaps you prefer to take private. And if you're like me, I'm sometimes in my office, other times I'm at home. And so I need to, you know, constantly sort of scan the scene before getting back down to work. For the tech stuff, restarting your computer or device before the session if possible. Now, on a day that I'm working back to back, I'm not going to start it, you know, restart it at each call, but I have found that shutting down my computer at night and then turning it on in the morning has been huge to help it, whatever that does, reset function. And then finally, having a backup plan. What are you going to do if your tech glitches? Or like today, I was going to do this presentation from home, but the storm from last night knocked out our electricity. And so I was really worried that I wasn't going to be able to do the presentation. So fortunately, I was able to come in here. Thank God I had printed up my slides on paper in advance, because I prefer that when I'm doing presentations, not just reading the screen. And that's where my printer is at home, you know. So had I not printed it out, then I might have had to bring my stupid printer into the office and yada, yada, yada. So, but also, so have your backup plan and then make sure you review it with your patient, client, or group at the start of each call, because even if you're thinking about backup plans, they have their minds filled with other stuff. So I've had sessions where we needed to get offline and get onto a phone, and it was ultimately fine, but my client was like, oh my gosh, you know, my phone was in my car and I'm here in my home, and we sorted it through. But had I thought to mention that in advance, it would have been a more seamless experience and we wouldn't have lost time. So those are some nuts and bolts. The next slide talks about ethical considerations, right? Again, the old ways of doing things is that we were face-to-face and in a HIPAA secure space. And so you probably didn't really need to think about the confidentiality of the place, not only that you're meeting in, but your clients are meeting in. You know, we're not behind the same door. We don't necessarily know how good the walls are. So if need be, making sure that you have some sort of a sound machine outside of your room. If it's one-on-one, it's a different situation, but with the group that I ran, we definitely would touch base to encourage members to do what they could to be in a private space. But not everybody had internet from home, so sometimes they were in different locations, or they would call in. And so that was part of my screening protocol with people of what's your comfort level if not everybody is in a private space, or perhaps they're at home and their loved one is making dinner, or the kids are popping into their room. And ultimately everybody was comfortable with that, but it was a conversation we needed to have. If you are working with someone who's not in a private space, encourage them to wear headphones if they can, because that will, first of all, allow them to focus better, but will also preserve confidentiality to the best of their ability. And then I think it's really important to remind patients that as telehealth evolves, that may change how they access the appointments or sessions. I'm sure many of you heard about all the Zoom bombing that was going on, where prior to really requiring the password or the host admission, sometimes people would have strangers pop into the room, which sounds horrifying, or somehow recordings of meetings getting up on YouTube, things of that nature. First of all, I never record any private conversations I'm having with clients, and probably organizations are discussing what may or may not be done, because there could be some ways in which having your doctor's appointment could be very recorded, could be very useful. But how are you going to navigate that as an organization? Who knows? So it was, while we had talked about confidentiality at the beginning of the group, it was a moment where I had to both inform to make sure that they were aware that this had happened, because I didn't want them to hear from someone else first, and then to reassure them, okay, so this is how things are going to function differently. And some people really hate change. And so at least if you plant the seed that things might continue to change, it catches them less off guard. The other thing is, God forbid something awful happens, like a medical or mental health emergency. It's really important to have the location of where you're actually speaking to the person on file, or confirming with them before you get on the call. So for my son's pediatrician, that's part of the check-in procedure, and perhaps that's what your organization is doing as well. But if you're not, that would be an important thing to have in case you do need to send help. And then for group work in particular, but even, even individual, there's probably some reason for setting, group norms and rules. So this first one is like, what are some of the potential confidentiality caveats? Well, of course, we don't, we're not meeting in the same room. How do you want to, handle the group members? How do they want to handle it if they run into people outside in the community? Oftentimes I just encourage people to say, if someone really isn't looking at you, then don't go over and say hello, but if they are willing to say hi, just try not to disclose, oh, you and I met at that, cancer support group, because not everybody is open about being in whatever services you're providing. I think that the groups that I ran were closed, so it was fortunate about that. As we would go through a screening, we would talk about a lot of these ethical considerations up front, but I didn't have to keep reminding people of the group norms and rules, whereas in an open group, something where the membership could change at each session. Of course, it's really important if you notice newer faces coming through, to remind everybody of some of these ethical considerations, so that everybody's on the same page and they don't feel blindsided. And then finally, working with challenging dynamics. Obviously, challenging dynamics could be challenging tech dynamics. It could be the personalities in the room. It could be the people that your patients are inviting to come with them. Cancer is obviously a very deep emotional experience, and a lot of the things that cancer impacts are these taboo subjects, like the fear of dying, things of that nature. And so if you're noticing some strong dynamics and you're not really sure where they're coming from, it can be tricky if, like, oh, I have this mission and now this interaction isn't going the way I had thought it would. So the way I've managed this is to both stay focused on the top priorities of the meeting while acknowledging the importance of unanticipated topics. Like, when I mention something to you, your brain is going to go possibly in a different direction than mine is. So how being able to redirect people, whether it's validating the feeling, hearing the concern, and then reminding them, well, this is my particular role, but you know what? That's an important thing. And if I can't personally help you resolve it, now maybe you can help them resolve it, but you need another session to do that. Keep in mind, what are the resources that are available for them? And that might be something in your own organization, or outside of your organization, or it might be a different person within your organization who would be the one to really help them with whatever concern is coming up. So, know the resources and then help them create some sort of a plan for addressing that concern, because I think customer service is so important in any given moment, and creating a plan often helps people really feel like their concerns are being taken, to heart. But managing affect while processing difficult conversations is going to be a piece of the work that we do. So in these moments, when I think about some of the group pieces that happened, I try to really, listen to whomever's actively speaking, but keeping an eye on those nonverbal expressions, because if you're able to incorporate that into your reflective listening, that might decrease the distress that the person's feeling, and then you can get into a more productive place. I always find it super important to normalize that cancer brings up many thoughts and feelings that are taboo to talk about openly, because I can't tell you how many times people worry that they're falling apart or they're losing their minds, when it's in fact like a normal thing that many other people worry about. And so in addition to helping to navigate those strong feelings through validation and reflective listening, sometimes we just need to take a pause and say, okay, like, emotions are high, let's take a pause. Can we take a breath? there's some grounding techniques that can be really useful into getting people back in their bodies. And then just that once you validated, you can go in with that compassionate reminders that everything that we're going through right now is a process and it takes time. They'll be more receptive to your reassurance if you're able to first acknowledge whatever the difficulty is that you're dealing with. So yeah, I think this is our final slide. Let me double check. Before we pause the recording, I would just like to say thank you for being here today. Thank you to the Maine Cancer Foundation for having me. It's such a pleasure to be here. Oops. Hold on. I don't know. I might have paused. So even though I put on my do not disturb, I just got a call. Anyways, and we're going to pause the recording now, and we'll have time for any question and answer.